All right, now we're going to talk about all the wonderful uses for a therapy ball. First, we're going to go over using a ball for a chair. We have 3 examples here. Grace here on the yellow ball, this is actually the perfect size. Sit up nice and straight for me, Grace. Where, as you see, her knees and her hips are at a nice 90-degree angle. That's the height of the ball you want it to be. And as you see for Xander, his ball's way too big. He's almost and then also a ball can absolutely be used for adults. You can use it in the office, and this is also, even though the ball is not that much bigger, as you can tell, this is just the right size for Lori. 90 degrees. And Lori, as you see, she's doing a little bounce on her ball as she's sitting there. That's also what you can suggest for kids in the classroom. It's just fine to do a little bit of a bounce. You all look so cute. Now we will move on to the other uses of a therapy ball. Let's go this way. Okay, first of all, we'll have Gracie do some work on her tummy on the ball. You can help her out by just gently, it's called floppy on the ball, where her body is just nice and loose and relaxed. And Lori's giving a little bit of pressure to make her bounce. Also, that's giving her deep pressure touch. And she's going side to side. Whatever the child likes best, you can just bounce it. You can go back and forth. And then, to make this a little more active and alerting, we're going to have Gracie walk her way out on the ball. A lot of kids, you will need to help them on this like Lori's doing, but then for the more challenged method, we're going to have Gracie do that all by herself and balance herself. Good job.
Spot if they get in trouble, just stop the ball. Stay close. So we have Xander do that?
Sure, yeah.
Okay. Xander, yep, we'll have you have your bottom on the ball.
Okay, and this one we're going to show how to do things going backwards. Now Xander likes this. He's fine with his head being backwards on the ball. Xander, can you take your arms and reach him back to the floor? And this you can do where he can then push with his arms and push back up, and then to his feet, and then push to rock towards his feet. Now some kids do not like that as much, so and that is also Lori's doing some bouncing with him and working with him on this. Going backwards on the ball is tough to do independently. I'm going to have Lori help Gracie get in that same position and rock back and forth. Once she's stable, she'll be able to do that on her own. It's a ball a little too, there you go.
Again, just if she needs a little help, I can stabilize the ball a little bit. Okay.
Nice job. And then all right, and one other way to use the ball that kids love is having the child, they can either lay on the floor, laying on their stomach or on their back. Maybe Xander, could you lay on your stomach on the floor? Not on the ball, just lay on the floor. All right. And then you're going to lay your head. Can you lay your head? Is it okay if you lay it on the floor? Would that bother you? Okay. And then Lori's firmly rolling the ball over his body. And if he puts his arms out, reach him out to the side like an airplane, and then you can roll the ball on the arms too. And you can provide more pressure than Lori's applying if you want. Some kids really like the pressure. And then Gracie, could you lay on your back on the floor? And this way you're going to do more pressure on the legs and the arms. Once you get to the stomach, it's kind of pushes a little too much on the diaphragm and lungs. So just gently roll it. But you can really push once you get to the arms. Usually the preferred way with this is the child laying on their stomach and having it rolled on their back. Oh, and then next, we want to demonstrate laying on the ball on your stomach and doing a fun, like hitting a ball or a balloon back and forth, working on prone extension.
How about if we put one on the sitting ball and one on the laying ball?
All right.
Where'd that yellow ball go? Sandra, can you go give me the yellow ball? Awesome. Okay. Ready? So, Mister, I'm gonna have you sit on the ball right here. Awesome. And then Gracie, I'm gonna have you lay on your tummy over the ball. Okay, and we're just gonna play balloon pop. Balloon pop. Just pop it.
And try to really reach your arms out, Gracie. There you go.
Nice one. Good job.
So this, you're not only working on the vestibular and proprioceptive systems and prone extension, you're also involving visual motor skills, using the eyes and hands for the activity. And the best part is it's a very meaningful, fun activity. And the kids will often do this for quite some time. You could do this in a classroom setting, sitting on balls, and making it a group activity as well. And the last thing we'd like to demonstrate is using the ball against a wall, where you're going to bounce it against the wall and catch it.
Okay.
Bring your ball over, Gracie. Go ahead. Come on, Xander, bring your yellow one.
Okay, Xander. I'll show you what to do.
Gracie, you know how to do this one. Your brothers did this at home a lot.
Oh, Jacob?
Yeah.
Okay, ready? So, now catch.
And this, the ball being nice and heavy, and when they catch it, they're getting the extra proprioception. And once again, it's also a great visual motor activity. Nice job. And Gracie, why don't you demonstrate by going closer and not even making it bounce? Go a little closer. There we go. Nice. There you go. Excellent.